Moving on, 4 steps to achievement: plan purposefully, prepare prayerfully, proceed positively, pursue persistently. Considering these inspiring words, let's move to our next speaker for the webinar, Dr. Shobha R. She is a professor in the Department of Prosthodontics. She has received Research Incentive Award for the research and scientific publication. She has won various paper and poster presentation at national and international level. Received the Good Teacher Award by the Manipal University. So it's my pleasure to invite Dr. Shobha for the session. Welcome you, ma'am. The platform is all yours, ma'am.
Thank you, Soumya. I'll just share my screen, okay?
Sure, ma'am.
Is the screen visible?
No, ma'am.
No?
Yes, ma'am.
Oh, okay. So good evening, dear students. I'm Dr. Shobha Rodrigues, and in the next half an hour, very specifically, I hope to entice all of you to become prosthodontists, just like how other speakers wanted you to become pedodontist and orthodontist. I hope that all of you all will become prosthodontists. And most particularly and importantly, I hope to convince you that dentistry is the profession for you to be with, despite concerns in these unprecedented times. This is not the first pandemic that the world has faced. And this will not be the last pandemic also. In 1892, the Spanish flu nearly wiped out 5% of the world's population. Did dentists survive at that time? Yes, they did. If there's another pandemic, will the dentists survive? Yes, they will. And why will they survive? Because as long as human beings have teeth, dentists will survive. But the question here, my dear friends and students, is not survival. All of us will survive. The question is to succeed. Okay, so how do you succeed? Okay, what do you envision to succeed? Okay, so my mantra to success is to begin with the end in your mind. Where do you see yourself 50 years from now? That, and start working towards it. Okay, remember, dentistry itself is special. Dentistry itself is a specialization. If you can foresee where you want to be 50 years from today, you predict your future and you work towards creating it. This will definitely lead to your success story. There are certain lessons that the pandemic that you have to learn. What lessons you will learn from this pandemic? You will learn lessons of hand washing. You will learn lessons of immunization. You will learn lessons of immunity. You will learn lessons of good hygiene practices. Take all this forward and go ahead and create your own success story. Okay, and what is success? Yes, success is mastery or getting a master's in your clinical skills. Yes, it is developing a good control over your clinical skills. But I would like to slightly digress from my specified topic of focus on prosthodontics and just remind each and every one of us that success is not just clinical skills. In today's world, if you want to succeed, be it in prosthodontics, be in just any field, be it in just dentistry, okay, you must know marketing skills. See, today the whole world is gone online. This pandemic forced the whole world to go online. Everybody has innovated. You will have consultations you have consultations. You book your car online. Okay, you book your meals online. So why don't we also implement this marketing tools for our own benefit? Okay, so you may have the best clinical skills. Okay, you may have a great practice. You may have all the necessary requirements to be a successful dentist. But if nobody knows that you are there, if you don't market yourself, how can you make a success story? This is what marketing is also very important. to your success. Then is management. See, I finished my BDS in the year 1991 from a very prestigious college, Government Dental College, Mumbai. When I finished when I got my BDS, true, I learned certain clinical skills, okay, but my soft skills were literally zero. I came from an aided school, okay. I knew 2 words of English, just yes and no. And I never knew how to communicate with the patient. I did not know how to develop any interpersonal relation with patients. I did not know how to empathize with patients. If there was a crisis, the first person to faint was me, myself. No, so all these management skills are very important in your success story. Okay? Your clinical skills, your mastery in your profession will account for just about 15% of your success. Your management skills, your marketing skills, everything. And I say do everything ethically. Everything has to be done ethically. Okay, that will also contribute to your success. Today's the scope of my presentation is to give you what you could do in prosthodontics, and I will go to that. But let me tell you, the entire success story is just not your clinical skills. Okay, it will be how you manage, how you talk, okay, and how you sell yourself. Everything within the bounds of ethical practice. Okay, so as I tell you, I will focus on your domain skills. Okay, that is your clinical skills. Okay, rest assured that there are other contributing factors that will contribute or that will help you to make your story a success story. Okay, remember, dentistry is an elective treatment. Okay, it is not a compulsive treatment. Okay, if you have a heart attack, you definitely have to go to the doctor and seek treatment immediately. But if you have an abscess in your tooth, that patient will come to you. You will relieve the abscess. Then he may choose to come or not to come. Okay, so you need to innovate. And if you want to make a success story, you have to ensure that that patient comes back to you. Okay, so today I'm going to focus on why prosthodontics. Okay, in a general practice, my dear students, in a general practice, and this is all my personal observation. Whatever I say here are my personal thoughts. Okay, in a general practice, as I have noticed, most patients, the majority, the chunk of patients that will come to you for conservative reasons, for restorative reasons. Okay, the majority of patients that come to you will come to you for restorative reasons. That means your bread and butter, okay, your bread and butter is going to come mainly from your restorative skills. Okay, but bread and butter are just survival skills. Okay, just survival. But you have to succeed. So you need jam. Okay, so you need bread, butter, and jam. And prosthodontics is going to take you there. Okay, prosthodontics is going to take you there. Okay, so that, and I will tell you why. Okay, I will tell you why. Okay, so and see, what I talk generally. Okay, I'm not I'm talking generally, and I'm speaking in favor of something that is very close to my heart. Okay, okay. So when you go for a conservative restoration, okay, you do a simple restoration. You do a class 1 or a class 2 restoration. Okay, and after the restoration, the patient says it is slightly high. Okay, you see, the patient will say it is slightly high. What you will say? You will say कुछ नहीं होगा. You will say कुछ नहीं होगा. 2 दिन में ठीक हो जाएगा. 2 दिन में ठीक हो जाएगा. It will become okay. But क्या ठीक हो जाता है? The patient adapts. Okay, your restoration is still high. Okay, the patient adapts. Patient adapts. That the muscles adapt to this assault. And what happens? You are creating a patient for future some disorder in the TMJ. This is just the infancy state, but the patient is moving towards there. Okay, the patient is moving towards there. You finish your orthodontics. Okay, you're looking very nice, pretty. Okay, very pretty, but your occlusion is unfinished. Okay, occlusion is unfinished. Patient will complain of pain in the night, muscles are paining. And then if you don't pick it up, okay, the patient is moving towards certain PMJ disorders, okay. Likewise, in most branches of dentistry, see, occlusion is a factor that is common in all branches of dentistry. Occlusion is a factor that is common in all branches of dentistry. But the master program in prosthodontics teaches you greater finesse, okay, greater finesse in picking up these deficiencies, okay. If you as a prosthodontist do not have the right attitude, despite having your master degree, okay, you may be just a zero, okay, you may be just a zero, because the attitude, the passion, the perseverance, the determination, the sincerity is not displayed, okay. But if with the right attitude, okay, with the right attitude, the right set of principles, okay, definitely you will move a great distance. And that is not true only for prosthodontics, okay, that is not true for only for a master degree, that is true for any BDS degree, okay. I am of the opinion that dentistry, okay, at its highest level, dentistry, I repeat, dentistry at a highest level can be practiced, okay, can be practiced by any personnel with the right attitude, okay, with the right attitude. This master's degree, just in any subject, okay, okay, will propel you perhaps towards academics, okay, perhaps towards research, okay, but the right attitude, okay, right attitude, the right temperament that any profession requires, if it is displayed by a BDS or an MDS degree, the person, they will definitely move in the right direction, okay. And before I go into the scope of prosthodontics, this is what I want to nail, this point I want to nail before I go ahead, okay. Okay, okay. So now I go to prosthodontics, okay. So we have so many things to do. We have removable prosthodontics, we have fixed prosthodontics, we can treat PMJ disorders, and there is sleep apnea. I'll go in slight detail with this, okay. Now we do complete denture prosthodontics, we do partial denture prosthodontics, maxillofacial prosthodontics, okay, fixed partial dentures, implants, full mouth rehabilitation, splints, stents, and whatsoever. Now tell me, all this can it not be done by an ordinary dentist, by a BDS? Okay, my dear students, just to just to digress from the point, after I did my BDS, I worked with a BDS doctor for 5 years. I mentored under a BDS doctor for 5 years. Okay, I learned my dentistry because of him. Okay, I learned my dentistry because of him, and I have yet to see a prosthodontist or a conservative person working. I don't say superior, okay, working, as good or better than him. And I only attribute it to the right attitude. Okay, so I say a complete denture can be given by a BDS. It can be given by a prosthodontist. But the question is, what more? What more a prosthodontist can add to your complete denture? Okay, with the right attitude and the temperament. Okay, for example, a prosthodontist can include something called as balanced occlusion in your complete denture. Most general dentists may not be able to do it. Okay, most general dentists may not be able to do it. That is what a prosthodontist could do. Okay, maxillofacial prosthesis, obturators. Okay, recently in our department, okay, our department was called to our local government hospital to treat all these mucormycosis cases, okay, where they resected considerable portions of the patient's palate. And you know what? They asked us our opinion practically in all the 22 cases which I saw. And they asked us, doctor, how could we how could we improve the quality of life for these patients? Okay. That is what the point that I'm trying to make is prosthodontists also have a major role in an interdisciplinary disciplinary approach to treating, patients with palatal defects or with facial defects, or let's say as a generalized term, maxillofacial defects. Okay, fixed partial denture. A BDS can give a fixed partial denture, definitely. Okay, definitely. But what more can an MDS degree or what more value a prosthodontist can add? Okay, he can take care of the parallelism. He can take care of the conservation of tooth structure. Can a BDS not do that? Definitely they can do. If the attitude is right, they will do it. Okay, then your implant supported prosthesis. Okay, implants, but we generally think implants are placed by oral surgeons. Implants are placed by periodontists. But do you know that when an oral surgeon places an implant, he sees where the bone is and then he places the implant. When a prosthodontist places an implant, he sees where the tooth should be there and he places the implant in center of that tooth. The point that I'm trying to make right now is a prosthodontist will prosthetically drive an implant so that the implant is in the best aesthetic position. Whereas, most probably, other specialties may not. Again, I say it is an individual temperament. Okay, anybody can learn anything, and anybody with sincerity will have the best approach. Okay, full mouth rehabilitation. Okay. All these branches of prosthodontics, for example, not only prosthodontics, all branches of dentistry has occlusion as its integral component. Okay, in academic setup in institutions, what happens is when the crown is broken in conservative, they get pushed to orthodontics. When the patient complains of pain, they get pushed to complaints of pain in the muscles of mastication and all, they get pushed to prosthodontics. Okay, if the implant is placed in an unaesthetic position, then to correct it, they get pushed to prosthodontics. So what I'm saying is, prosthodontics, the scope is wide. Okay, wide. When I was a BDS, okay, I did my MDS approximately 7 years or 8 years after my BDS. Okay, that time, the first rank always went to orthodontics. Okay, second went to conservative. Third rank went to prosthodontics or a clinical subject of your choice. But if you see the past few year trend, okay, just see, and I stand to be corrected. I won't be surprised that the top rankers chose prosthodontics as their subject, as the first choice of subject, mainly because the scope is wide. And I told you, if you want bread, butter, as well as jam, this is the area which you have to be. TMJ disorders, okay, okay. We give different types of splints, okay. Okay, what are these stents? Okay, when a periodontist does a surgery and they want to hold something in place, they ask us to make a stent. Or a surgeon does a surgery and they want to hold their pack in place, they ask us to give something, to give us a device to hold their stent. Now, what is the sleep apnea? Okay, so the sleep apnea is, many patients when they sleep, especially elderly, obese patients, okay, okay, when they sleep, the amount of oxygen that goes to their brain is reduced. Okay, now the best treatment for sleep apnea is something called as the CPAP machine. It is the gold standard. Okay, CPAP machine is the gold standard. Okay, but there are many patients who do not accept it for various reasons. It has been found, okay, that if the jaw is slightly held forward so that the passages are open, the chances of oxygen reaching the brain or the passages increases. So, prosthodontists are called to give such devices to patients, okay? Even anti-snoring devices, when you give this, the same device, similar device, okay? the muffling sound of the snoring is decreased. Many a times, okay, spouses complain that they cannot sleep with their partner, mainly because the snoring is unbearable. Okay, all you need to do is to send them to the prosthodontist. Okay, all you need to do, and this is in a lighter vein. Okay, okay. So what I'm trying to tell you is our scope nearly covers the entire spectrum of dentistry. Okay, entire spectrum of dentistry. Okay, however, whatever it is, okay, the attitude has to be right, the passion should be there, and the perseverance to improve and to correct ourselves. Okay, all of us make mistakes. Okay, making a mistake is no sin. Okay, but we have to improvise and we have to become better. Okay, so this is, I put a big table of what all prosthodontists can do. Okay, but that is notwithstanding, a general statement that I make is that if you want bread, butter and jam, this is the place to be. Okay, okay, so these are all types of prosthesis. Okay, you need not bother now. If I am able to convince you that this is the place you have to be, you will be doing all this. Okay, you will be doing all this. Okay, okay, so all types of prosthesis, I have practically enumerated everything, but if I tell you the names, you may go to sleep. But as I told you, know, our scope is very, very, very vast. Okay, now a few pictures. Okay, okay, so we can give, I told you, complete dentures, and these are all done by our postgraduates. Okay, I've also not done it. Okay, these are all done by our postgraduates in our department. Give a complete denture. Can a BDS doctor do it? Definitely they can do it. Okay, what more can an MDS add to it? Okay, they can refine the occlusion, they can refine the impression, they can add a certain element of finesse to their treatment. Okay, they can add an element of finesse to their treatment. Okay, 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 they can, so you can give a balanced occlusion. You can see our dentures are more stable. Okay, the dentures are more stable. Okay, okay, removable partial dentures. Okay, this we give. Can a BDS give? Can any other branch give? Definitely they can give. Okay, what finesse can we add? Okay, we can control the impressions, or we can make the dentures passive. Okay, we can control the occlusion. Okay, so this is what a further element that a prosthodontist can add to it. Okay, then we can give overdentures. Okay, what are the overdentures? Dentures which are resting, okay, over the natural teeth. Okay, they can rest over the natural teeth. They can be teeth supported overdentures. They can be implant supported overdentures. They can be magnetic retained overdentures. Anything. The scope is wide. Okay, so this is what we can give. Okay, okay, then what are the stabilization splints? I told you, post orthodontics. Okay, many times post conservative restorative treatment. Okay, patients have got so many issues. Okay, so both as a diagnostic measure and as to eliminate interference. Okay, and it is not within the scope of the discussion to go in further detail. Okay, okay, we could give certain amount of splints both to understand whether the occlusion is contributing to the error, and if so, to correct and rectify it. Okay, okay, then okay, full mouth rehabilitation. Okay, all rehabilitation. Okay, under using correct diagnostic principles. Okay, correct see, all this work is done by our postgraduates. Okay, postgraduates, all in the cycle of learning. Okay, 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 so what I'm saying is, look at the positive aspect of it. Okay, all in the cycle of learning. Okay, so we can, and with well controlled occlusion. Okay, so full mouth rehabilitation. Okay, fixed dental prosthesis. Okay, I told you. Okay, a graduate can also do it. Okay, everybody can do it, but we could add greater finesse to it. We can add greater finesse to it. Okay, obturators, maxillofacial defects. Okay, okay, maxillofacial defects is what we can provide to our patients. Okay, ocular prosthesis, orbital prosthesis. Okay, this is what we can give our patients. Okay, now this is why, this was a request from the orthopedic department. Okay, The patient had fractured the radius bone of in an accident. Okay, so we gave them a stent. We gave them a stent, an economical stent. Okay, and we to the extent we were worried whether this is going to stay in the body, whether it's going to be biocompatible. To the extent now they have requested us to make a patent for this. So what I'm saying is, just not our field, but there is some interdisciplinary approach. Okay, we can help ENT, we can help orthopedics, we can help radiation oncologists, and all this. Such a wide scope of treatment we have. Okay, implants we can give. Okay, implants we can give. Okay, full mouth implant supported prosthesis we can give. Okay, so our scope is unlimited. Okay, it's a wide field. Okay, all you need is to take the plunge in prosthodontics. Okay, all you need is a plunge in prosthodontics. Okay, so so once again, to reinforce what I want to tell you is begin with the end in your mind. Okay, where do you hope to see yourself? Okay, and if you and work on it. Okay, work towards creating your own future. Okay, develop the right attitude, passion, and perseverance. And let me just add the same thing. Let me endorse what my previous colleague spoke. Okay, she said that a postgraduate degree opens up the research field to you. Perhaps without this degree, it may not be as exciting, okay, to get into research as with the degree. Okay. With this few thoughts of mine, I would like to wish each and every participant present here all the very best. Okay, and I wish you all a very bright future. Okay, thank you very much for a very patient hearing. Okay. That's all from my side. Thank you. Thank you, Soumya. Thank you, Deepa.
Thank you, ma'am, for your wonderful and enriching presentation. We would really appreciate the composed and a graceful presentation and a success mantra in a prosthodontics for our participants by your thoughtful words, ma'am. Thank you, ma'am.
Thank you very much.
Now, we would request you to kindly receive our token of appreciation from the organizing committee in the form of certificate.
Okay, thank you very much for the certificate as well. Thank you so much.
Thank you, ma'am.
Thank you.
Over to you, Soumya.
Thank you, ma'am. Thank you, Shobha, ma'am.
Thank you.
Thank you, Deepa.